Hello, and welcome to the next episode of the How We Make It in New York podcast. So, this week you just have me. Unfortunately, Michael is out of town. He is outside the city on a trial in upstate New York. Very exciting, very stressful. And if I have to tell anyone some advice about going on a trial, it would be don't do it. Try and settle it. He really, really, really cares about his clients and works incredibly hard, but I could just hear how stressful it is, how time consuming it is. I'm sure for the clients, it's very expensive. So try and settle it. But if not, you should hire Michael because he's literally working day and night to get his clients to a resolution. So he'll be back next week. But we'd recorded an amazing interview that we wanted to release as soon as possible because she is fantastic. It's Dr. Nadia Rodriguez from No Limits Dental. I can't wait for you to hear her interview. And just to give a little real estate update, because I think that this will be coming in the next few weeks. I'm sure you've seen headlines about the FAIR Act, which basically means no broker fees. Because I don't know anyone who wakes up wanting to pay a broker fee. I mean, I don't. I have, even though I am a broker, because I got a good deal. But it really doesn't mean no broker fees. It just means that really the landlord is going to be paying the fees, unless you hire your own broker as a tenant's agent. And this is going to start basically June 11th. There's a chance that something will change, that there'll be some type of a stay. What does it mean? I think rents will go up. They're already unbelievably high, but the rents will be going up, I think. We'll see how it shakes out over the next few weeks. Of course, if you're listening and you have any questions about what all of this really means, I'm happy to answer questions. I stay up to date on everything going on. But we definitely have a housing crisis in New York City. I don't know if this is the best way to make things cheaper. I really don't think it will make things cheaper in the long run, but time will tell, and that's June 11th. But this week we have an amazing interview, like I said, with Dr. Nadia Rodriguez. She has an amazing background and unbelievable positive attitude, and talking to her would never make me scared to go to the dentist. So check it out. Thanks for listening, and here we go. So, for our next guest, we are so excited to have Dr. Nadia here today. I'm so thrilled to have you on. So, you are a cosmetic dentist in Midtown. And when actually me and Michael were talking about doing a podcast, I was like, I put your name on like the list. It's like, we have to interview Dr. Nadia. And not only is she not a broker or a lawyer or something, so like a little bit different, but I was like, she has the best energy and an amazing practice. So I'm really excited to have you on. So why don't you introduce yourself and tell our listeners and viewers a little bit about yourself, your educational background.
Yeah, thank you so much for having me.
Of course.
I'm really excited to be here and to share my story. Uh, so, um, yes, I speak Russian and Spanish, and the reason is because I am half Russian, half Dominican.
Oh, cool.
I grew up in Washington Heights, which is the northern part of Manhattan.
Mhm.
And for me, that was just the most perfect community to grow up in because they have a large Dominican population there. And they actually also have a big Russian population. So I really felt at home growing up in Washington Heights. All of my early childhood education, however, was completed in Midtown Manhattan. So I have a very strong, heartfelt just love for Midtown Manhattan. And ever since the fourth grade, I wanted to go to Cornell University because I wanted to be a
Oh,
veterinarian.
oh,
And so once I got into Cornell and started studying animal science, I quickly realized that veterinary medicine probably is not for me. And so I started looking into other fields or other hobbies that I like to do just for fun, just because everyone always says your job should be something that you love, that you almost like don't even have to get paid to do. So that's what I was looking for in my career. And so when I was thinking about the things that I love to do, I landed on the fact that I still loved science, but I also really loved art. And so when I was looking at different careers, dentistry came up because it checks both of those boxes. It's very much all about science and art. And I am someone who could sit and sculpt things, paint, for hours, and you really don't have to pay me to do that. So I just knew that dentistry was the way to go. I got into the New Jersey Dental School, which right now is called Rutgers. It wasn't Rutgers before, but now it is. And I started off as a general dentist, which was really important to me because I wanted to be able to offer all services to my patients. And as a general dentist, you are not limited in terms of what you can do. So you can do everything from extractions, fillings, crowns, braces, like you can do anything as a general dentist.
Mm-hmm.
But as I got further along in my career, I started realizing that a lot of my patients who had bigger issues, like they were missing multiple teeth, and or had cavities, many cavities. They really enjoyed their experience with me holding their hand through really complex procedures. And so that's how I landed on cosmetic dentistry, because cosmetic dentistry is not only about each individual tooth, but also about how each tooth relates to all of the other teeth and how the smile relates to the entire face. And
Wow.
so I just realized that I enjoy doing these big cases. My patients enjoy doing these big cases with me. It seems like there was that basically there wasn't a doctor that a lot of these patients felt comfortable with to hold their hand through some of these really big cases. And so that's how I landed on cosmetic dentistry. And so I love it.
Like, oh my
Wow.
goodness. Wow, that's
Yeah.
amazing.
So I have to say though, I was a little self-conscious when I heard that you were coming on to the podcast. I mean, I thought you were great. I know you're great, and I'm happy that you're here. But I know I have the worst teeth on the
You do
Zoom
not have the
call.
worst teeth.
I think
You
Stop.
I
did brush
do.
your teeth this morning. I saw you.
But yeah, I just had to say that. So,
No,
you know,
you should never feel like okay, you should never feel like your teeth don't look good. And honestly, if you really did feel that way, I don't think you actually do. But if you ever really did, then obviously the solution is go see your dentist, just fix whatever it is that you don't like. The solutions are usually pretty simple. You have a beautiful smile, so you
oh,
should be very happy and proud of it.
thank you. You see, Lauren?
Yeah.
So don't make fun of me for my teeth, okay?
I never make fun of you. Just sometimes I'll say to him, I'll be like, "Did you brush your teeth?" Be like, "You got to get up, brush your teeth." And like I'm like, well, so it's funny actually. My dad, who he's passed, but he actually did like a lot all the testing for dental schools and like was like
Oh,
really involved in all of that. And like so there's like all these dentists that we were around. I don't really know. But there was like all these conferences and stuff. So I know and I actually met a dentist at one of my showings, this was a couple months ago, and he was telling me that the dental test is like the hardest test. Like he was like a dentist. He's in his like 70s, 80s. He said he's still traumatized by that test. So
yeah,
it
yeah.
was like,
I took that test with the flu. It was
oh
really
my God.
bad.
Like when I mentioned
Wow.
that to him, he said that that test has haunted him for years, and he has I forgot his name, but he has like some big practice in like the city too. And I was just like, oh, okay, and it was just like a thing. So
Wow.
it must be like a really big deal.
It
Um,
is. I mean, it takes days to finish. It's not like a one day thing. It's like a couple of days.
oh
And
my
so
God.
yeah, I took so I'm certified as a dentist not only in New York but also in New Jersey.
Oh
And
wow, okay.
so yeah, so I had to like make sure that took all the tests, passed everything. I did my residency, so I'm like really certified everywhere.
Oh wow, okay. So you're like a super dentist, I guess, like a super
Sure.
lawyer, a super dentist.
Yeah, national
So
dentist.
so
So
speaking of, oh yeah, no, Michael, go ahead.
no, I sorry, as we're talking about some of the career successes that you've probably had. Why don't you tell us about maybe a success story? You don't have to name names, of course, but maybe a success story about how you maybe changed somebody's life with the work that you do. Would you mind sharing one with us?
Of course. So when I think about a meaningful case, there's one patient in particular that I often think about. And so she was relatively young when I first saw her. I think she was probably in her late 40s, 50s, missing half of her upper teeth and a few of her lower teeth. And so you could only imagine if you were missing so many teeth, what would your confidence be like when you're speaking, when you're chewing your food? How confident would you be when you walk into a room? How confident are you? Like, who are you as a person if you're missing that many teeth? And when she came to see me, she had a partial denture to replace those missing teeth. And I asked her, how long have you been missing these teeth for? And she said, oh, since my 20s, like not a big deal. And I was like, wow, well, you know that there are other options out there. Like you don't have to wear a partial denture. And she like looked at me kind of like, not really sure if I'm saying the truth. And I told her, like, look, they're dental implants, which basically function like your natural teeth. And you'll never have to roll over out of bed and pick up a piece of plastic and put it in your mouth to smile or chew your food. You will essentially have your natural teeth again. And she was a little skeptical, and I ended that appointment telling her, replacing your teeth is an investment. It's an investment in time, an investment in money, but you're never going to regret it. You just got to do it. And I saw her a few months later, and she said, yes, let's do this. And with the help of a periodontist and an orthodontist, we straightened her teeth out. We got those dental implants, and I restored all of her teeth.
Oh my God.
The process itself took probably up to 3 years. And I'll never forget the day when she got her teeth, and she became a different person. She was bright, excited. I mean, she even came in with like a bottle of champagne the next time to celebrate. I mean, she was just over the moon, so excited. And I mean, to this day, every time I see her, she just is always thanking me for restoring her teeth and for guiding her through this process, because she wasn't aware that she could even do this. And just seeing who she is now is enough of a reason for me to do what I do. And so that's really like the patient that I think of.
Wow. Well, I'm happy that she celebrated with champagne instead of red wine because that's a no, right?
Right.
Oh yeah.
Yeah, it was hard for us because we wanted to drink the champagne, but then we were like, we have to get back to work.
Oh yeah. And yeah, you don't want to be like a little tipsy with like a scalp or one of those like things in someone's mouth. That's true. That's true. So speaking of like the things that you offer, so you obviously do like implants, you do cosmetic dentistry. I see you also do Invisalign, which like I know a lot of people have Invisalign. I actually did Invisalign like years ago, and it's really popular. Is that like something that's really easy, or is it difficult? Like I'm sure it's also evolved since I've done it. I know it's a
Yeah.
little difficult.
Yeah, so Invisalign is it's clear braces, so a lot of adults are really into it. What it involves is scanning your teeth. It used to be impressions, so I don't know if when you did
I
it,
did, yeah.
you had
For like,
impressions, right?
yeah,
Yeah.
yeah.
So now there's no messy material, no
Oh,
goo that you
good.
have to deal with. So we scan your teeth and we create a digital model of your smile. And then we design how it is that we want your teeth to look at the very end. And we give you a series of clear plastic trays to progressively move your teeth along until they're nice and straight. It used to be that you had to wear the trays once every 2 weeks. It also used to be that patients would be in Invisalign for years,
Hmm.
and their results would be nice, right, but not always guaranteed. Now technology has advanced so much. You switch the trays out once a week. I
Oh,
get my patients in and out of treatment in 3 to 4 months, generally speaking.
wow.
And so yes, Invisalign is much easier now. Um, and for anybody who's looking to straighten their teeth, I would highly recommend Invisalign. It's great.
Yeah. Yeah,
Mm.
no, it's definitely really popular. And I think like I just feel like your confidence is so connected to your smile. Like especially like what I do, I see people every day and I walk in, people are like, hi, nice to meet you. Like I am like that's what I do all day, introducing myself. I'm in the people business, not really the real estate business, but or like on camera for like acting. So it's
Yeah,
like it's just so connected to like your presence, which is like all day, every day, that like it's kind of like people can be really scared about the dentist, like not go, but like it's so your teeth are so important. And like if you have like something in your teeth that like or something with your it like throws off your whole like juju or something,
absolutely.
right?
I bet you get a lot of compliments for on your teeth,
Yeah.
right?
Yeah. Oh, yeah. I've had people.
And it
Yeah.
feels good.
Yeah. Which is good. And I'm like, so does that mean you want to buy the apartment?
I have nice teeth, therefore you should buy this apartment.
Yeah. Oh,
That
do you like my
that
smile?
is really what it is because yeah, like if you feel good about yourself, then you're gonna put yourself out there more and you're just gonna show up different
Yeah.
in every single interaction that you have, whether it's like just friendships, relationships, work. So that's
Yeah.
like, yeah, your smile is incredibly important.
Totally. And so but for people, there's a lot of people who are I'm sure you've had people come out. I've been to the dentist in a decade. Like people are scared. Why should people not be scared to go to the dentist? Like what, like if you had somebody who's like, I haven't been in 2 decades or whatever, a decade, like, and you had to, like, what would you tell them to be like, it's okay.
By
Come,
the way, I'm not that bad, okay? I don't skip decades when it comes to
not
seeing
decades, but
maybe a year.
yeah.
Don't tell
Yeah.
anybody
Okay.
though.
Well,
Sorry.
you put it out there. So yeah, but why should people like go to the dentist?
Well, first, I will say that if someone is scared to go to the dentist, they need to realize that I would say most dentists, they want you to like them. Like I want my patients to want to come here, to come to my office. I don't want them to dread coming. I want the experience to be good. And I will do almost anything to make sure that my patients are comfortable. So it's a relationship that I cherish and I protect and I try to cultivate a great relationship. So if my patients say at a first visit or at a second visit, if they say, every time you use that instrument, it really hurts. I don't like it, like I'm going to change. I'm not going to use that instrument, or I'm going to go a little lighter, or I'm going to try to find a different instrument to use. So people should not be afraid of the dentist. We want patients to be happy. We want them to address their oral health. And honestly, if you find a dentist that you don't feel comfortable with, you just got to switch. You have to find someone that really does value you as a patient, who wants to take care of you. It doesn't serve anybody well if you're scared.
Yeah.
So it's yeah.
So, in addition to doing fantastic work for your clients and helping them, your patients rather, to
Mhm.
achieve those beautiful smiles, you're also running a business. And of course, that probably brings a whole host of challenges. So, why don't you tell us what are those challenges? What are the most challenging parts of running your own medical practice in New York City?
The most challenging part is wearing all of the hats in the office. So I am the person that obviously has to take care of the patients, right? I'm the dentist. I am head of marketing, head of HR. I make sure that the bills are paid. If there is an issue with dental insurance, I'm the one who has
Mm.
to make the last call. When my staff comes for training, I'm the one that has to show them how to do what they need to do. So the hardest part is definitely wearing multiple hats, but I am grateful for this struggle or for these challenges, just because honestly, there are a lot of people who don't have the privilege to be the boss. They don't have the privilege to be the go-to person that everyone asks questions. So I feel very fortunate to have just the ability, or the position to have all of the answers. And if I don't have the answers, then obviously I look for them. But so despite all of the challenges, I enjoy what I do, and I enjoy being the boss.
Yeah. Yeah, me too. I enjoy being the boss of me.
Yeah, it's
Uh,
challenging
Well, wait,
probably for you too.
who says you're the boss, Michael?
oh well, see, I can't win. Let me tell you, I feel like Rodney Dangerfield sometimes. Anyway, so this is like the perfect question for you because you've probably seen it all when it comes to, teeth. So, what are the three things that you wish people would know about their teeth?
So the first thing is I wish patients knew that there is a systemic connection to your oral health, which basically means what's going on in your mouth has an effect on your whole entire body. There's research that shows that patients with poor oral health are more prone to Alzheimer's disease, diabetes, stroke, heart disease. For pregnant ladies, low birth weight babies, these are all very real risks. And so
Hmm.
I wish that more patients took their oral health seriously, because it's not just about the mouth, it's about your entire body. So that's the first thing. The second thing, I think that everyone nowadays is crazy about looking young. So we have people who are like in their 70s and look like they're in their 30s. And I think everyone would agree that prevention is key. And so I wish that people knew that wearing a retainer or a night guard is the best way to keep your teeth as they are right now. And I also wish that patients knew that they have to replace those retainers every once in a while and those night guards, because they don't last forever. Some of my patients come in with retainers and night guards that are like 15 years old, and it's just they aren't retaining your teeth the way that they're supposed to, because they do age. But if you want to prevent your teeth from wearing away, from shifting, retainers or a night guard, that's the way to go. And then the third thing that I wish patients knew is just how important it is to have straight teeth. And so I am not talking about someone who has like one tooth that's just like kinked out a little bit. That that's fine. I'm talking about people who have like severe crowding and and just don't want to address their crowding. And the truth is that when you have teeth that are severely crowded, it is a very difficult situation to maintain as a dentist, and as a patient, because when there's crowding, you can't brush as well as if your teeth were straight. It's harder to floss. And one might think like, oh, well, what's the big deal? Okay, it's hard. Who cares? Well, if you aren't keeping your teeth nice and clean, then you're going to end up having periodontal disease, or you're going to develop cavities. And so
Mm.
someone might say like, okay, who cares? And I'll go to the dentist, I'll fix my cavities, I'll come in for cleanings, whatever. But it's not that simple. When someone has crooked teeth and they have cavities, as a cosmetic dentist, it makes it much more difficult to restore teeth that are crooked. And if you don't even care about the cavities and the fillings that you need, and you're just like, well, then, okay, I'll lose a tooth. Who cares? Placing dental implants in a site that's not ideal because of crowding is also so much more difficult. So I do wish that people didn't, I wish that more people understood the importance of putting your teeth in the right position, because that is going to help you with your oral hygiene. It's going to help prevent a lot of wear and tear. You'll keep your teeth much longer. And so even if, say, insurance companies aren't willing to pay for adult ortho, it's okay. You don't have to do everything that the insurance company says that you're going to do. And it's a really, it's like the most basic investment that you can do in yourself is putting your teeth exactly where they're supposed to be. So that way there isn't significantly more wear and tear that's unnecessary happening.
Totally, totally. Okay, those are all like really good points, and I hope people like write them down, and then if they have those issues, they like come see you immediately.
Yeah, isn't it so sad when someone finishes braces or Invisalign and like they don't wear their retainers? Because
Oh
then it
my,
all goes to nothing.
oh my God. It's like all for
So
nothing. And then it all
sad.
shifts back. You're probably just, oh, sorry. I don't know why that's coming through. Um, so okay, so going kind of back, you're saying like multiple hats. So you actually have an amazing social media presence, and I hope everybody goes and follows you, and we'll do that at the end. But like how do clients really find you? Is it mostly been referral? I saw that you've like seen like thousands and thousands of people, like your amazing reviews online. Like how have you been getting most of your referrals?
So patient referrals. So I think when patients hear of a good cosmetic dentist, they tell each other like they don't want to hide that. And I think so
Mhm.
many people do struggle with a good dentist. Like a good cosmetic dentist is like a good hairdresser, right? Like you stick to them forever, right? And so, but for some reason, I think a lot of people struggle with finding a good dentist to take care of them for their whole lives. So when someone finally feels like they're being heard and seen, it's just they're so happy to recommend my office, anyways. And so most of it is yes through patient referrals. People will find us on social media, but I think that social media people who go on social media, it's more like to confirm that I am who I am rather than like I'm gonna go find a dentist, so let me go on social media.
Oh yeah.
Usually someone will like refer me to them and then they'll go on social media and
Oh,
just
I
be like,
see.
oh, what is she really about? What has she really done? Is this
Oh,
person
but then they'll love you because you have like the best vibes. So then they're like,
lying?
oh, I have to make an appointment. So I'm sure it's all, yeah, all great.
So, you know, patients love you. You're wearing many hats. You have a fantastic business, a fantastic cosmetic dentistry practice. So, where do you see it going in the next 5 years? What does the future hold for you?
So the next 5 years, I am going to continue focusing on efficiency. So developing the technology that I have in my office to make my appointments as efficient as possible. As New Yorkers, nobody has time for any problems. Nobody has time to go to the doctor, the dentist. So anything I can do to invest to make sure that people are in and out quickly, that's where I want to be. So in 5 years, I hope that I can deliver multiple crowns, all quickly, all in one visit. That's my hope is just to continue offering relatively pain-free, efficient dental care. So yeah.
Amazing, amazing. So, okay, now it's time for the question that we've been asking everybody who comes on the podcast. And it's what is a one piece of advice that you would share with people of like how to make it in New York as a cosmetic dentist or in any type of medical practice? Like, is there just something where you're like, this is what my advice is?
Yeah, can I tell you that I love this question because I feel like
Yeah.
this is the most valuable question that you ask everybody on your podcast. And
Yeah.
so my answer is
Wait, let me give you like a drum roll.
Drum
Okay.
roll.
um,
I need to throw in a sound effect. Maybe that'll be like the new thing.
the biggest piece of advice is treat every single client, or like in my case, patient, like it is a privilege to be in front of them. I think that if you treat every single person who comes to your business like they are special, like they are worthy of your time, like if you just feel fortunate and just and thankful for their presence, then your business will always grow. And so in New York City, there's a lot of competition, right? There are so many cosmetic dentists, there's so many realtors, lawyers, right? So why does any one person choose you? And I would say if you treat everybody like it is a privilege to know them, it's unique. It's actually not that common. And so that's how I choose to treat all of my patients is like they are like they're my children. I like love them.
I love that. I love that advice. And I think that that's like so, so, so true,
Right.
especially in a business where it's referral. It's like you become like very, at least, I mean, I think all of us do, but like very intimate with like your patient or client. Like, at least me, like I don't just say, okay, apartment. Like I get like involved. Like I like try, become like friendly with people and like people like then they start to tell you about their lives. Like I'm sure it's the same way. So it's like, if you just and also just like have the faith that like you're gonna have a long-term relationship with somebody and it's not just like once a year, it comes back. It really does.
I
Yeah.
totally agree. I treat my clients the same way, like family. I respect that they're actually asking me to help them. I just wish that, the judges would feel privileged as my clients feel when I'm representing them. I wish they would feel that it's a privilege for me to appear before them, but not always the case. But, we're working on it.
Send them some candy or some
Is that okay?
some flowers.
What's the safest candy to send them? Asking a dentist.
I don't know, nuts.
Okay. That's a good happy medium. This has been like so amazing. So I wanna we're gonna have everything in the show notes for people to follow you, and if they want to make an appointment, maybe they need a new dentist, maybe they're like, oh my God, finally a dentist that I could like laugh with a little bit and not be scared of. So where can everyone find information about on social media, your website?
Yeah, so we're on all the major social media platforms like your Instagram, Facebook, TikTok. And so the handle is at No Limits Dental. And I just actually also started posting videos on YouTube.
Oh,
So
cool.
same thing, No Limits
Awesome.
Dental. And our website is nolimitsdental.com. And so if anybody wants to book an appointment, you just click the big red book appointment button.
Oh, and also you're located in Midtown Manhattan on what, West 58th Street?
Yep, 58th between 6th and 7th Avenue. It's like kind of
Perfect.
right in the middle of Manhattan.
Oh, that's like so convenient. I mean, you could, it's basically right near Columbus Circles or that like little area and, all the like major everything. So people can get there really
Yeah.
accessibly.
Yeah. And I'm open really early too, because like a lot of people like to come before work.
Oh,
Sure.
okay.
So yeah, I started at
Get it
7.
over with.
7. Oh, yeah. Oh, okay. 7. Wow. So that's like a early. Yeah. People want to go like, I think early. It's always like get it done in the morning and then
Yeah.
the rest of the day. So
Yeah. My favorite patients are the 7 a.m. patients.
yeah.
Because they come in with a mission where they're like, okay, I'm coming in, getting my checkup and cleaning, I'm out,
And
I'm not wasting time.
their mouths are usually cleaner, right?
Yeah,
Right.
that too.
Sometimes. Anything else to share with our listeners? Any other tips or tricks or advice?
No, I think that just yeah, don't be afraid of the dentist. It really, I feel like we're your friends, and if you ever, I mean, I think this is true for really any profession, right? If you ever meet a professional that you aren't a fan of, I would say ask your friends for a recommendation, and then I think because usually people hang out, like-minded people hang out with each other. So if someone has a recommendation, like they probably will find someone that you love and adore. So, but yeah, having a good healthcare provider, it's so valuable, so important.
Absolutely.
So true. Nadia, I'll see you tomorrow at 7 a.m.
Sounds good.
And thank you so much for
Amazing.
joining. This was
Thank you
great.
guys. Thank you. Thank
Yes.
you.
Thanks so much. Have a good one.